And the treatment is called quantum magnetic resonance therapy. So this is non-invasive tissue engineering. We work with our partner back in Bangalore, India, who is the inventor of this technology. And he has been working on the science of the cytotron for many decades now. And it is the culmination of his research efforts that has resulted in the development of this novel therapeutic modality. So we talk about validated engineering solutions to human health problems, and that will be the premise of the talk today. No, I think this is the wrong one. This is not the slide. No, this is not the slide.
This is another presentation.
John, this is not the slide. John, on my computer. She had the right slide presentation there. No. She had the right one. I'm sorry for the delay. Sergio. Sergio. Can John take my laptop? We took it on the stick, but it's not the right one. It's called clinical experience. Yeah. Yeah, this is the one. Okay, I'm sorry for that slight glitch. So this is an emerging paradigm in medicine, and I'm going to So like I mentioned, so we are going to talk about regenerative medicine today. It suffices to know that this is a method for tissue regeneration and degeneration, and the concept has been now issued a European, a Chinese, and a US patent. So I'm going to go ahead and describe the technology to you. So if you look at the electromagnetic spectrum, all of you are quite familiar with technologies for medical therapy that are positioned in the electromagnetic spectrum. If you look here, this is the realm at which the cytotron functions, which is even lower than your microwave towers, your microwave devices, as well as your cell phones. So it's extremely safe, whereas what you all are used to using, whether in therapeutic areas or for diagnostics, is all positioned at the higher hazardous end of the electromagnetic spectrum. So that is how we are very safe in the operation of the cytotron. Near radio and radio waves were commonly used in communications, oceanography, and in submarines, but this is for the first time that we have developed a therapeutic modality for use in human beings. So this is a US patent that has been issued for the cytotron. There is also a European patent that has been issued, and also a Chinese patent. So this was the remarks that were made by the US Patent Office, This is a new invention that will go a long way in the years to come, as this is the first step to communicate with the living cell and alter their functional process. As seen above, the invention is simple to use, non-pharmaceutical, and natural. This is the first time that there is a clear establishment of communication at the cellular level. So without much more ado, I'm going to tell you about the premise of how this works. Every tissue in the human body has a certain membrane potential. Now this is what is required for the cells to divide, for cells to grow, and to either regenerate or to get injured, get inflamed, and get destroyed in the process of disease, as well as in many metabolic processes. So if you look at a normal cell, the voltage of the transmembrane potential is about -70 to -90 millivolts. This is very well established over the years. There are several million papers that you can refer to. If you have a cell that is inflamed, and all of you know in this room that the root cause of most diseases starts with inflammation, the voltage of the cell rises to about -40 to -60 millivolts. When the cell becomes cancerous, the millivoltage of the membrane rises to -20 to -30, and that is when all the cancer pathways kick in, and there is a problem with your protein pathways. Your p53 is induced. A lot of the other cellular pathways start developing. And when the cell is dead, obviously, the millivoltage of the membrane falls to 0. Now, the rationale for rotational field quantum magnetic resonance is used to selectively alter the transmembrane potential and achieve cellular control in pathological tissue. In the case of arthritis, in the case of cartilage, in the case of other tissues, for example, pancreatic diabetic, when you're treating the pancreas in diabetes, you have fixed proton density measurements. So you know what are the radio frequencies that can be used to resonate the membrane potential and induce certain protein pathways that are responsible for that disease process. In the case of cancer, I will come to that when I talk about specific slides, we use a variable proton density measurement. So I'm going to first talk about regeneration. So I'm going to talk a little bit about diseased cartilage and diseased joints. I understand we have a mixed auditorium here. We have people from several disciplines. So I'm going to cover the basics of the technology and talk about the various aspects of disease that can be controlled using a very simple a 10-year-old patient, which was the first case of focused resonance nanopermeabilization treated in Bangalore. So these are the promising clinical outcomes. Minimal cytotoxicity, no platelet or blood transfusions were required during chemo plus FON cycles, extended disease-field progression-free survival, improved quality of life and pain relief, and patient compliance for chemotherapy was extremely significant. And this is a PET scan for one of the patients that was treated on this FON protocol. He had about 6+1 cycles. This was a recurrent nasopharyngeal carcinoma. So in most of our cancer patients, we do a PET scan pre and post-treatment so that we can pick up any residual metabolic disease and make sure we are targeting multiple lesions anywhere in the whole body. So if you look at the competitive landscape, I'm sure a lot of you in this room, I do not have to tell you about what are the various categories, what is the quality of life impact, the device cost. I know for a fact that the proton beam therapy device, which costs upwards of $200 million with an infrastructure of I don't know how big, I know that they take about 6 blocks of University of Maryland to have a proton beam therapy center. If you compare that with having multiple cytotrons in a center, it's not only do you have a positive quality of life impact, it's extremely affordable, it's palliative and to a large extent curative, although we don't, are not claiming that for the purposes of FDA and COFEPRIS. We do not have any collateral damage. We do not have any adverse reports. We have an FDA safety report that was done with 100 patients with solid tumors done in the USA, and the safety report showed no adverse reactions. The most common adverse reaction we had was for brain tumor patients who might feel a little headache. But other than that, we have not seen any of that. And we've had a bladder tumor patient who bled out during surgery. This was an advanced CA bladder who have anyway, they have bleeding per urethra, and this patient had an episode while on the cytotron. So barring those 2 cases, we have had no adverse reports, and that too, it was not a consequence of the cytotron treatment, but we do a little careful when we treat bladder tumor patients. For example, the biggest advantage, I think, is that we can treat any and all solid tumors. We have also recently treated a multiple myeloma patient, and we did a whole body cytotron, which you cannot do with any, you do it for prophylactic radiotherapy, but we did whole body cytotron treatment for a patient with very advanced multiple myeloma who came on a stretcher. And 3 months later, I can even show you all the video, this elderly gentleman, 75 years and plus, was walking around as if he had been resurrected. And these are seminal cases which may seem 1 in a million, but we can repeat that in the clinical trials that we are now proposing. And it's a simple standalone machine with no additional shielding costs. So all of us know that cancer is a very complicated disease, and there is no real magic bullet. But as an oncologist, as a cancer geneticist, I am very encouraged that we are headed in the right direction, and hopefully one day the cytotron will find its place in clinical medicine. Thank you, and I'll be happy to take any questions.
Muchas gracias. Thank you very much for your talk. The time is very short, but I congratulate myself to have you here. Thank you very much. Para todos ustedes, los que estén interesados, toda la información científica está en la Subdirección de Enseñanza e Investigación. El que quiera tener todos los artículos están en un link, está en la nube, de tal manera que no necesitan acabarse la memoria de sus computadoras. Los que quieran tener más información de esto, por favor acérquense con nosotros a la subdirección, ya sea con el doctor Paul Mondragón o con un servidor. El día de hoy, a las 10 de la mañana a 12:30 del día, estaremos reunidos en la subdirección haciendo el trabajo preciso para que lo más pronto posible pueda estar armado y en funcionamiento este aparato dentro del hospital. Ese es el compromiso que han adquirido las autoridades del Centro Médico Nacional 20 de noviembre. Gracias por su atención, muchas gracias por estar con nosotros y no va a ser la primera vez que nos veamos aquí con los doctores, estaremos atentos a darles los pormenores de cómo va el resultado con los pacientes. Gracias y buen día. Thank you very much. This is for you. This is one for your husband, and the other one is if you want to do a copy, you don't have to take out from this.
Okay.
This is for your office.
Thank you so much.
Okay. Thank you very much. Thank you. Thank you. What we're going to do is to take you for a tour of the hospital.
Los invitamos a degustar un café aquí afuera del hospital por cortesía de la dirección.